Becoming a CRNA, I went through college, 4 years. I got my nursing degree. I worked and practiced as a nurse in many healthcare settings. After a few years, I decided, hey, I would like to practice anesthesia. So I went back to school again and got my master's in anesthesia nursing. It was a long process, but it was definitely worth it. I think this is a great career. As a nurse anesthetist, we use a variety of different sciences as well as technology in order to be able to administer anesthesia safely. So for example, cutting edge technology, we use a monitor called a pulse oximeter that can measure the amount of oxygen that's circulating in your blood. So we take a sensor similar to this. There's different kinds, but they all essentially will do the same thing. You put it on your finger, or we can even put it on your ear, too, as well. And then we'll connect it to the monitor. There we go. And then after a few seconds, we're going to see on the monitor what my oxygen level is. Now, isn't that amazing? It uses the technology, the sensor uses the technology, infrared technology, to detect the color of my blood cells within my finger. And that tells us if my oxygen level is low, high, or within the normal range. And what you're seeing above 95% is definitely within the normal range. And I know everyone likes a 99 or a higher, especially when you get that on the test. So I think getting a 99 on my oxygen is definitely great. So being a nurse anesthetist is very challenging because we not only take care of young, healthy kids like you, but we also take care of folks like your grandparents or very little babies too as well. And because of that, the training is very extensive and very in-depth. We learn a lot about medicine. We learn a lot about the human body. We learn about what we can do in order to provide a safe and caring environment for our patients. It's a wonderful job. It's challenging. We get rewarded every day when our patients have a successful surgery and they have a good outcome and they get an improvement in the quality of life. Now, if you're thinking about going to healthcare or specifically becoming an anesthesia provider, then definitely stay on the science track. Math, chemistry, biology, all those things, they all come together to be able to provide the knowledge and the know-how to be able to do what we do in healthcare in a very safe manner. So you guys are awesome. Keep it up and stay in school. You're going to do great. Good afternoon, boys and girls. My name is Kato Harilal. I'm a certified registered nurse anesthetist, or for short, CRNA. So I'm an anesthesia provider, and if you've ever had surgery before, then more than likely you have probably met one of my colleagues who put you to sleep so you can have your tonsils taken out, possibly a broken bone fixed, or even your appendix, or any other kind of surgery. CRNAs work all across the country, and we work in not just hospitals and surgery centers and an operating room just like this, but we also work in clinics, dental clinics, and different healthcare settings all across the United States. Now, as a CRNA, I've been very, very happy with doing what I do, and that's taking care of people just like you to make sure that you can have a successful surgery. So when you come into the hospital and your doctor says, hey, I think you need to have surgery, then you'll probably will meet me or one of my colleagues, and we'll talk to you about anesthesia and tell you how we're going to keep you safe during the procedure.